My name is Chris Malaster, and it is my pleasure to share the stage here with two long-term collaborators that have supported telehealth in their careers for quite a long time. We have a three-part presentation here. Kathy will kick us off. Kathy Latender creates transformative improvements in organizations to catapult their organizational performance to new heights. She's a founder of Latender and Associates. She was previously a vice president of planning and organizational excellence in a rural regional health system, and she holds a master's degree from the University of Michigan Public School of Health and Health Services Administration, and got, like me, an engineering background, which is why we work together really well in biomedical engineering. Our second presenter today will be Dick Kersell. He's the CEO of Community Care Network in Rutland, Vermont. He's been with CCN for over 15 years and has served in the role as CEO since 2015. His career as a leader spans 30 years, and he's worked across different domains, different areas. And then I'll be taking us home with the last part. And I'm on the board here of the Matrix, so any suggestions for improvement for the conference, any positive feedback or constructive criticism, send it my way. And I'm the founder and CEO of Ingenium Digital Health Advisors. So without further ado, we hand it over to Kathy here for a great sharing of the journey to achieve transformation through strategy-driven execution. Kathy.
Thank you, Christian. So I am also pleased to be joined by my longstanding colleagues, Dick and Christian. And today we want to feature the story of Community Care Network and their organizational transformation over the past decade through a strategy-driven approach. It's not that long ago, just a decade ago, Community Care Network was in a crisis state. They were at risk of losing their designation status by their measure regulator. And under Dick's leadership as the interim and now a permanent CEO, Dick has set a clear strategic direction for the organization through a very collaborative process. And Community Care Network is now a thriving organization. And that same regulator now regards this organization as a true innovator and partner. And the community at large is constantly benefiting from their innovation and their dependability as a care delivery organization. So we're going to highlight their strategic approach to transformation. And then we're specifically going to feature two of their strategies around telehealth and then around their digital health strategy. These are just a few of the dozen strategies that Community Care Network consistently focuses and executes on. Some people like to say that culture eats strategy for lunch. I think this observation is a bit more profound. That without strategy, execution is aimless, but without execution, really strategy is useless. Unfortunately, there's two very prevalent organizational cultures that do gobble up strategy for breakfast, lunch, and dinner, I would say. A number of years ago, the CEO of an organization who was receiving our nation's highest award for organizational excellence, the Baldrige Award, described how his organization culture used to be a do organization. And as he said from the podium, they left a lot of messes in the organization with that culture of do. Pun fully intended there. And we're also all familiar with another culture of the perpetual planning organization. These organizations collect gorgeous strategic planning binders all on their shelves in their offices. What we're going to feature here today is an organization that takes an approach. They set a plan, they execute the plan, they check to make sure it's working, and they adjust as they go. We hope as we share some of the highlights of Community Care's approach that you'll identify some pieces that work for your organization's size, scale, and organizational maturity. We have a couple of resources on the resource section, a couple of white papers that might help you kind of look at how you do your strategic direction setting and execution, and find some pieces to help match your size and maturity to truly drive transformation through setting strategy and implementing strategy. This approach can be used for strategies both big and small, and we'll feature a couple of those today. So I'm going to just share a couple of key concepts, and then I'll hand it over to Dick to share the case study of CommuniCare Network and how they've put this into practice over the past 7 years. And then Christian will share the specific strategies from CommuniCare Network as it relates to telehealth and their transition to a digital health strategy. We'll have time for questions, and then we'll bring it all together. A couple of years ago, Dick and I were presenting at a symposium and about their strategy-driven approach. And Dick said, you know, Kathy, it's just textbook. And I said, well, I guess a lot of people haven't read the textbook like you have. And so we want to just share a couple of pages from textbook strategic direction setting and execution. CommuniCare Network was one of the organizations when the public health crisis hit in 2020 who took a different approach than many organizations. So many organizations around the country, when the public health emergency hit, went into crisis mode and put their strategies on the back burner and really delayed many priorities in order to deal with the crisis at hand. And many organizations, it took well into late 2021 before they began to take some of those other strategic priorities off the shelf. CommuniCare Network was exactly the opposite. CommuniCare Network, in fact, accelerated the implementation of their strategies in 2020 into 2021. They got done in weeks and months what they had planned to get done across the entire year because they were clear on their why and had really good alignment in the organization around their strategic priorities. One of the pages from the strategy textbook, if you will, that Dick was referring to, I represent in this funnel. Whenever we do strategic direction setting, I always think of it as a prioritization approach, a funnel of choices, if you will. And it's always essential to start with understanding at the top there, the environmental context. What does our internal performance look like? And what is the external environment? And what do they need from us? Our customers, our marketplace, our communities. And it's really in the context of that environment that we then affirm our mission, set our ambitious vision, and then make a series of choices coming down that funnel. What specific goals are we going to focus on for the next 3 to 5 years? CommuniCare Network expresses those goals as pillars of excellence, like many healthcare organizations do. And then from there, making choices about which strategies and in any given year or cycle, which specific action plans to accomplish. And it's essential to remember that we implement strategies to improve performance results. Some organizations get caught up in the plans and lose sight of what is the performance metric that we're trying to move the dial on for the benefit of our customers and clients that we serve. Another page from the textbook comes here from the Baldrige Framework for Organizational Excellence. setting strategy is just one part of a leader's responsibility, a leadership team's responsibility. And at the foundation of organizational excellence is measurement and analysis, as you see highlighted here. And as Dick will share in just a minute here, at Community Care Network, everything they do is measured and monitored so that their strategies are informed by measures and their strategies are monitored by measures so that they can adjust when things aren't going exactly as planned. And so with that, I'm going to hand off to Dick to share more of their journey.
Great, thank you, Kathy. Let me go to my full screen. Thank you for that introduction, and good morning, everyone. I'm looking out at snow in my window, and I'm assuming that where you are right now, there probably isn't any. But Kathy, very kind in terms of her description of our organization and our focus. And I just want to let you know, I'm going to be talking to you for a few moments as from a leader's perspective and not a tech expert. While I love tech and I love to keep up with the latest technology, I'm really looking at it from a leader's perspective. And I know Christian's going to talk about change management strategy, because that's something we've had to focus a significant amount. I also want to just let you know that we are in the very earliest stages of development as it relates to our digital solutions. So this is really going to be about the journey and the process for how Community Care Network has advanced the work that we have underway. So getting back, so in terms of Community Care Network and Rutland Mental Health Services is one of the two organizations that's under Community Care Network. The way Vermont has structured, and you can see where Rutland County is in Vermont. Vermont is unlike many other states in that it has carved out regions, basically counties, which designated agencies operate for community-based mental health services and also developmental disability services. So Community Care Network's Rutland Mental Health Services is the designated agency for Rutland County, Vermont, which you can see in the orange where Rutland County is located in Vermont. And we have a population of about 60,000 in Rutland County. It is rural in nature, very, very mountainous. Our organization itself has a little over 350 employees and about $35 million worth of revenue, and that's our website. So the way things work in Vermont in particular is we have an annual contract with the state of Vermont, we and every other designated agency in Vermont. And there are 10 designated agencies serving 14 counties in the state of Vermont. And the state of Vermont, through its departments, have established, for the most part, case rate per member per month fixed payments for the provision of these services for children and for adults. So for Rutland Mental Health Services, which is in our 71st year of operation, we have an array of child and adolescent services, substance use disorder services, developmental disability services, spanning the entire lifespan from birth through elder care. So it's very, very comprehensive. We serve about 3,000 individuals per year here. And as I said, we're relatively rural. The county is relatively rural. There's 28 towns, mountainous. And when we talk about technology, in particular, talking about telehealth and digital health, broadband access and accessibility are a significant issue in where we're located. Kathy talked about planning. And Kathy and I started working together a number of years ago, actually, when I was not in this role. I was still with this organization, but I was basically tasked with helping the organization with strategic planning. And Kathy was a vice president at our local hospital in charge of planning. And that's how we originally connected, because I'd seen the work that Kathy had done and was very impressed by its discipline. I was very impressed by its approach, and it resonated. So that's how the relationship started with Kathy. So she's correct that we, as an organization, we are guided by a planning cycle. So we have the traditional. When I said to Kathy that it was sort of textbook, I was surprised when I learned other people aren't probably opening that textbook. But we are very, very much focused on a traditional strategic planning process. We usually have 2 to 3 year strategic plan horizons, although they have been as short as 12 months and actually 6 months at one point in time when there was a great deal of uncertainty and instability. But for the most part, we're looking and planning 2 to 3 years ahead. So telehealth adoption was, as Kathy had said, this was in our plan before the pandemic. So a year before the pandemic, we had already articulated this was something telehealth, and understand that telehealth, in particular in mental health, was not widely used or understood in terms of how it could be done, how it could be deployed. So we basically had already adopted a goal and a strategy to begin to work on basically importing and embedding telehealth in some of our services for primarily mental health services. So we thought we could take it slow. This was back in 2019, and Kathy has worked with us over the years, as has Christian now on this initiative, but Kathy has worked with us over the years on our strategic planning when we go through these exercises, which are pretty comprehensive. So we thought we would take it slow, never imagining what was coming. So there are many issues as it relates to telehealth or any type of technology delivery system in Vermont and where we live. There's access issues. We're rural. Transportation is a challenge. Weather's a big challenge. So this was one of the reasons that we really wanted to take a look at perhaps telehealth and now looking at digital health being a solution for us to help bridge some of those gaps. There's a significant provider shortage, in particular in psychiatry and clinical mental health professionals. This is across the nation. So we were looking at how we could perhaps, work, and this is again pre-pandemic, how we could develop a telehealth strategy that we could use for, individual and group psychotherapy, family therapy, and case management services, medication management, whatever. In addition, we are also looking at telehealth as a defensive strategy because our clinicians were starting to get postcards and emails and other outreach from these new telehealth startups that were kind of the siren song. Come work for us. You don't have to leave your living room, and we'll pay you, and you're not going to have all of the burdens of being in a private practice yourself. So it was also a defensive strategy. So this was something that we had planned on doing. So how did we go about doing this? Well, first off, we engaged with, Christian, back in the spring of 2020. We had already signed an engagement with Ingenium to work with us. We felt we really didn't have the in-house expertise and knew that it was more than just using your smartphone or laptop. It was more than just what we're doing here. There were many obstacles that needed to be overcome. And frankly, the equipment was the easiest part, but not necessarily how to use it correctly. And so we did that. We engaged with this and understand that this was all processed prior to the pandemic. We appointed an in-house resource to lead the effort. We needed somebody inside the organization, not necessarily a telehealth expert. They weren't, but as somebody that was skilled in project management that could really work with us on leading this effort. We formed a steering committee, which included some of our clinical folks and certainly from our tech side of the house. And understand, we're kind of a tweener organization. We're not small and we're not huge. So, we really have to be careful about how we appropriate our resources. And it's not like we have a large IT team, but the folks that were involved in this were very committed to it. We also had to take a look and select which programs we were going to pilot telehealth viability. So no, we didn't just launch it and figure that we were just going to do this across the board. We wanted to look specifically at where do we think telehealth could work, and where is the need for telehealth. And we took a look at our readiness and capacity, and we could spend a long time talking about that, and in terms of how clinicians interact and their openness to using a modality which for the most part has been foreign in the mental health field. We also collected a lot of baseline data, which we wanted to start with, because as Kathy had talked about, measurement's very important. You don't know where you've been, you don't know where you're going, and you don't know if you get there until you know where you've been, and that where you've been is the baseline data that we collected. So we were really looking at this from a kind of just a planning process. Another thing that we had to really make some decisions on was selecting a technology platform, which has changed from what we actually started with for the most part. Privacy was a big concern. And in the early stages of this, and we're just talking just a few years ago, the delivery of mental health services, and in particular substance use delivery services, in particular with more protections at the federal level, far beyond HIPAA, we really had to look at platforms that were going to provide us with that assurance and that formal level of privacy. We also developed clinical guidelines for use, and clinical guidelines were essential. What cases are appropriate for using telehealth? And client preference, for the most part, should be the driver if it's clinically appropriate. I do want to say that for the most part, our organization is a community-based mental health and developmental disability organization. We don't serve what our medical director calls the worried well. Generally, the work that we do, we work with a lot of individuals with severe and persistent mental illness and developmental disabilities and substance use disorders. So we're working with a lot of very often tough and chronic cases as well. So we wanted to be clear about who this was for. We wanted to develop workflows that made sense. We wanted to make certain that the whole concept of etiquette for providers, they knew how to go about doing this and doing it right, because it wasn't a matter of sitting down with your phone and connecting with somebody and just going about it. There were a lot of things that had to go into this. And then, oh, by the way, we also had just onboarded a new EMR shortly before this. And for those of you in the field know that EMR integration is absolutely essential. And we were just getting used to using an EMR, a new EMR, let alone adopting telehealth. So as this was evolving, we were also looking at emerging care technologies and digital mental health solutions. So we were doing all of this, then all hell broke loose, and all hell broke loose with the pandemic. So fortunately, because a few years before we had decided that we were going to do this, we had already established a pathway and already established a strategy. So what Kathy talked about rapid deployment was not because we were really good at doing it. It was because we had already set it up. We'd already teed it up. We were ready to go. So that when the pandemic hit, we really were able to pivot and pivot quickly. Was it easy? No. And did we have a lot of challenges and obstacles? Absolutely. But the fact that we'd identified it early on was essential. So fast forward to 2022 and how this has evolved and how we're looking at digital health. So, based on our basically our experience with telehealth, and also looking at what was happening, what was the pandemic doing? The pandemic has changed our lives. There's no question. There has been a massive shift in online preferences and behavior, convenience and choice now rule. There are far more digital natives, as they're called, individuals that are very comfortable in the digital sphere. And it's hard not to notice the billions of dollars invested in digital health solutions. So the mental health industry, by and large, hasn't changed a lot in decades. It just hasn't. There's a lot of great books and resources that have been written in the last few years about that and how it's starting to evolve. But unlike other medical fields, it has not seen the evolution. This is one of those, perhaps. So what we were looking at doing with these two strategies, we were really looking at solutions that would help complement our clinical services. We really wanted to look at things that would increase client engagement and treatment, which is one of the biggest obstacles, in particular when you're dealing with severe and persistent mental illness. We wanted to be looking at how we could support an individual's progress in their recovery or supporting them on their journey. We're not looking at how perhaps we could use digital health as a substitute necessarily, although there's some fascinating research going on about how it is used as a complementary therapy. We also wanted to strengthen client-clinician connections. And so we're also looking at measurement-based care, which is another area that we're really focused on. And that is an area which helps us document and actually use data to determine progress during the course of treatment. So we had established during the pandemic that we were going to start looking at innovative practices and digital solutions. So how are we going about doing this? Well, as I said, we are really in the early stages of this development, and this is a very young field, and the research is mixed at this point in time. So what we are doing at this point, and we just have launched this in the last probably 6 months or so, is we have looked at identifying a priority area. Where are we going to adopt a digital mental health solution? And again, unlike telehealth, or like telehealth, we're not looking at something that's just going to get widely adapted. We're really going to be specific about where is there a need for digital health. A lot of research is going to go into this. We want to look at how we can time this. We're going to follow a very similar process as we did with telehealth, and hoping that there isn't some disaster afoot that's going to make us accelerate it even further. And we also want to really take a look at, how this is going to fit in with our other modes of service delivery. And that now includes telehealth and virtual services as well. So we're going to pilot 1 to 3 focused areas, most likely in the substance use disorder, perhaps area, and perhaps PTSD. It's to be determined. But one of the things we're finding as we're looking at digital health is that most of the venture capital, and there's been billions of dollars in the last few years, it's not going to treating the most severely ill mental health patients. It is, I think in some cases, it's just being used for, what the pandemic has caused with, anxiety, depression, but perhaps not to the level of the work that we do as a community-based mental health. So we're looking at establishing this and establishing clinical guidelines that are going to be able to complement digital health with what we're currently doing. And one of the areas, obviously, is that telehealth was a leap for many of our clinicians who had not done it before, very skeptical about it. Well, if you think telehealth is a leap, digital health is even more so. But generations are changing, and younger people today, in 20 years, as they become predominant in the work that our organization does, this is going to be the way so many of them want to engage. We just established a text line for crisis. And younger people using that text line, feeling much more comfortable because who picks up the phone nowadays, right? So what are some of the lessons I learned in the last couple of slides here for you? Kathy had talked about really being clear about the why before getting into the how. I love tech, but I don't like necessarily chasing shiny things. So every step that we've made has been based upon a why. Why do we need to do this? What have we seen from our customer base, from our market, from the industry? What are we seeing that should make us look at this? Don't be, this is one thing that in particular with my colleagues is don't be gobsmacked by the latest new thing. Frankly, the technology itself, it's only a part of it. And it's actually sometimes one of the easiest parts to address. But it's very, very important to not get so enamored by what the latest thing is, because in many cases, the latest thing may be it may be a mood ring, and it's just not going to hold. Another thing, obviously, is making certain that your business model matches your approach. Now in Vermont, again, the way Vermont is funded for these services, primarily we are mostly Medicaid through the state of Vermont, although we just received a grant from SAMHSA to stand up a certified community behavioral health clinic model. So we're very excited about that. So it's one of those areas. The FDA has actually approved now 5 digital apps for PTSD and ADHD, substance use, and insomnia. So this is starting to get some traction. But there needs to be selection of those digital solutions that actually are evidence-based and proven to actually work. We also have the fail fast attitude here. Look, we're not doing surgery. We're not doing that type of work. But nevertheless, if something's not working, let's move on. We are not so committed to a strategy that if it doesn't work, we change course. Not a lot, but when it's necessary, we will. Another thing is just really testing small pilot projects before launching them more broadly. That is really what we do. We did that with telehealth. Now, granted, when the pandemic hit, we had to move really fast, but we'd already started to test. So I felt much more comfortable about moving more ahead. And then, another thing is really getting buy-in, significant buy-in from the people using the new tech approaches, clinicians, clients, and whatever. Without that, basically, this is just something that, as Kathy said, with a plan, is just going to go on a shelf and sounded like a great idea, but it's not going to hold. And then just, finally, just a few things. Measurement and monitoring are absolutely essential. It is absolutely essential that you look at what are you going to look at? What are you going to measure? What are you going to monitor? And how are you going to do it? Do you have those systems to do it? The first follower concept, I'm sure many of you have seen Derek Sivers' first follower video on TED Talks, just about you need people more important than the leader is the first follower, the people that want to really become your most vocal advocates and will support you in this. I'm a big Good to Great fan. Many of you probably are. This is something that my role as CEO, since I've been in this role, I'm able to keep that pressure on like a flywheel, which is consistent and continuous pressure, because it's too easy to let up and just move on. Now, again, if something's not working, don't keep it up. But if it's working, that's the way it goes. And then just finally, now that we're into playoff seasons and March Madness, my two favorite quotes in terms of, as a leader, what you should be looking at. And of course, the great Wayne Gretzky, I skate to where the puck is going to be, not where it has been. That's what we were looking at with both telehealth and also digital health. And then now that we're in March Madness, Coach K, which is what you've done, is not nearly as important as what you're doing right now. And of course, my UVM Catamounts are going to be facing number 2 seeded Marquette this afternoon in March Madness. So go Cats. So that is my presentation.
Thank you so very much, Dick. All right, the room has filled. It seems like breakfast was really good here, and we also have 15 virtual attendees, so thank you very much. I think for those of you who have been maybe in change management, in transformation, innovation for a long time, right, the key thing is always leadership starts at the very top, and I think Dick is just a great example of making it very easy for us as consultants to come in and facilitate change. So we're changing over here the technology to make sure that in the room here we can see that presentation. Very good. I'll share a few of the artifacts that we created along the way working with CCN here over the last years. And let me just see if I can advance here. I can. The first phase that we launched, and that's what Dick talked about in March 2020, was just do it, right? So the call came and we went in and we said, okay, how can you help us to set up for telehealth, telemedicine? And so it was just do it, but do it thoughtfully. Then we shifted into limited, focused optimization, and then systematic optimization later in the fall, working on that. Then we took telehealth to the next level with a full integration. So we were doing localized optimization with the different programs that Dick mentioned, and then really took a step back and said, okay, how do we systematically anchor telehealth and integrate it into the delivery of care services? And now we're on the fourth phase, as I'm looking at them, and really looking, okay, building on the success, on the embracing of telehealth, on the integration of that. How can we use that to now look at digital mental health app, digital therapy, excuse me, digital therapeutics. And so that was kind of our journey. As Dick mentioned, paramount to our approach is always the mindset of change management. We're following the a.k.a. model, which stands for awareness, desire, knowledge, ability, and reinforcement. And it's a really great model to have in the back of your mind. There's some books out there, some training out there. I came across it at the Mayo Clinic 20 years ago, and I really love it. Only when you have those 5 elements in place is when you really achieve change. What's nice about this model is that if you take awareness away, you end up with confusion. So this model now can explain some of the resistance that you're experiencing and where it's coming from. So if people are confused, then they're not really aware. in Dick's organization, it was really easy because everybody was to some level, at least at the leadership level, aware that telehealth is a thing and it's something that CCN eventually will do, and so made it very easy to get started. Same with digital health. Dick started planting seeds years ago with this standard phrase, I love technology, but I'm not into shiny objects. And so everybody knew that this was coming. It was not a surprise. Again, that's where transformation really starts at the very top with the leader's mindset. If people are resisting the change, it's because they don't have the desire, right? So if they're not really motivated, why should I be doing that? Now, nobody could claim lack of awareness and lack of desire during COVID, which made it really easy to get started in telehealth and telemedicine because everybody still wanted to serve their clients, and telehealth made that possible. If you don't have knowledge about what to do, then there's reluctance to use it. If you don't want to make mistakes, you don't want to look stupid, and so if you don't know where to go, and then similarly, if you don't have the ability, if nobody provided you any training, then there's frustration. And so we very quickly did some website manners training. We told people, okay, you need to look into the camera to establish that relationship. You need to acknowledge that this is new. So we had some tips and tricks that we were doing. And then the last part is here, the reinforcement. If you don't reinforce, and that's what Kathy mentioned at the beginning, everything that CCN is doing is measured. And so all the slides also, I see people taking pictures, and I do that too to remind myself of the good content that is in there. But it's also in the handout section as well, so you can review that. So as I said, so that was the underlying desire, is to really have this as a change management approach. As I said, the desired outcomes as we launched then in August were to go from local optimization to organization-wide standardization, for having serendipitous outcomes, to have repeatable, sustainable outcomes, and preparing for the imminent and midterm future. So this was basically when I sat down with Dick in the summer of 2020 as we were planning the next phase. That was the marching order. Said, we want you to really anchor this systematically into our organization. And so what we did there then is a systematic baseline assessment as to where the organization is at. We've developed a few years back a telehealth program maturity model. It has different levels. Most organizations pre-pandemic were in chaotic and emerging, and actually that's where they stayed as well. If people approach telehealth by here's a webcam and a Zoom license, now go do telehealth, then typically it was not very well supported or coordinated. And the goal is to ultimately invest into telehealth, to make it integrated, to have it as a clinical tool that clinicians can use to deliver care at a distance in addition to delivering care in person. And so once it's fully integrated, it allows you to think more strategically about reaching new populations, about having a continuity of care. Dick talked about the snow in Vermont in bad weather. How can you still hold up appointments that otherwise would be canceled and transfer them over? So, and this is where the organization is at now. When we met them, it was already well supported in April of 2021. We had a lot of good things, but then the marching order by Dick was, okay, I want you to take this to the next level, get to integrate it with kind of dipping our toes into strategic. We went to arrive at that point. We used this kind of assessment tool here that talks about, okay, how many services are there, how many specialties, and then on the top you see the different categories. And so we had this systematic assessment tool, and then just evaluated them, where they were doing. They had some strong outliers, they had some things that needed improvement, and the box in green was the marching order that Dick set forth. And so that's basically where we were at the beginning, and then a year later we did another assessment, and we had moved a lot of things to the right, and then really were at that level where we were. But this allowed us to give us systematically, okay, where do we need to go, what do we need to systematize, workflows or technical support or leadership engagement, telehealth, steering committee, Dick mentioned. So this gave us a systematic roadmap of how to approach telehealth improvement for CCN. And then we ended up there. So the next step one then, okay, let's take a look at all the different elements that we need to systematize and standardize. And so this is a framework that we've been using. At the core is the virtual care strategy here in the middle. And that is the foundation is to, and Dick had already laid the groundwork in their overall organizational strategic plan, why virtual care, why telehealth is important to the organization. But where are we going to focus on? Is it adolescent? Is it child and family? Is it crisis? What are the different programs? So really have this prioritization available front and center, again, for the backsliding aspect of the outcome model, the reinforcement, establish a performance management system so that we know the utilization and reimbursement rates. We worked very quickly and continue to work on clinician engagement, which is key, because if clinicians don't feel comfortable using it, don't feel supported, then they're not going to leverage it as a tool. People did it forcedly so during COVID, but once COVID was done, once the Omicrons and all the other variants were through, now it became really a choice, and telehealth is only going to be used if clinicians feel that it is a good tool. In order to do that, we needed to have good support, we needed to have great workflows, we needed to make sure that the technology we were using was either up to par or was well understood, well trained on, so that people knew how to use it properly. And then we also needed to let the clients of CCN know that that was now an option that is available. So this is kind of the systematic process that we worked through in order to get them to the next level. Build a Gantt chart kind of project plan here, tackling the different things, and then meeting every other week with the telehealth steering team, which was a cross-disciplinary representation of the different programs of the different areas. So we had somebody from finance, we had somebody from technology, we had somebody from the different programs, so that we really had a great representation and could make decisions in those steering team meetings. Talked about clinician engagement. So this is some of the information that we shared, just bringing up a sample here. We looked on website manners training. We looked at facilitated when is actually telehealth appropriate in the scope of our clinical program, and then did a webinar on website manners that we recorded and is now available as a resource to maybe new clinicians joining. We also looked at the different methodologies on how do we launch a new telehealth service, or also we're now using the same kind of model on how to launch new digital health services, and really just shared a lot of information and helped in the implementation of workflows and using proof of concept approaches versus a pilot. And so just the whole work. But it was all on the foundation of leadership, having the complete buy-in, having it anchored in the strategy, and then having that telehealth steering team, which really helped with the governance of this program, and serves still to this date as a liaison to the leadership team. I think I have on the next slide here. Not coming up soon. So digital health, now that is the big transition, as Dick said. It's what does digital health mean for our organization? And so in essence, digital health in general in healthcare is the use of technology to improve the efficiency and efficacy of care decisions, of care delivery, and any ancillary healthcare processes. So that's kind of the generic definition at this point, where we're in the process of customizing it. What does digital health mean for CCN as an agency? Mentioned that we had the steering team established for telehealth, and they have these kind of 5 responsibilities here. First, to establish the digital health and telehealth standards, provide the accountability. So from a measurement perspective, again, anchored here, what Kathy shared from the textbook of the Baldrige model, and what Dick mentioned about assessing the progress on the strategic plan. removing barriers to optimization growth, so really leadership responsibilities, and then prioritize, prepare, and present the requests for new services to the leadership team and liaise with them. So that is the responsibility. It's made of, as I said, a very multidisciplinary team, not at the senior executive level, but kind of 1 or 2 levels down, so have really cross-representation. So now we're on the digital health transformation roadmap here to focus still on telehealth, continue the improvement of telehealth, and take us to the next level, strategic and ultimately transformative in that maturity model. Really continuing to look at clinician satisfaction, to identify opportunities to really make them feel comfortable to use it as a clinical tool. And then we're focusing on refining the digital health strategy from the more generic statement in the strategic plan to the specifics as to what to focus on, and that's to launch a digital mental health app, leverage some digital mental health technology in the organization as a proof of concept, learn from that, decide on the process on how to launch future digital health innovation projects. And then we're also establishing a process by which to screen, because there's so many, there's the 5 approved FDA apps out there, but there's a whole plethora of apps that are, some of them well researched, and so, but how does an agency like CCN decide which solution is good, or what are the problems we're trying to solve? So we're systematizing that process. So it's not the apps leading the innovation, but it's rather the problem solving that leads the innovation. And then we're planning a first digital health services launch here in the second quarter of 2023, and continue to work on the innovation adoption. And then the last slide here is kind of the model that we're following here for the adoption of digital health. And it starts all with an idea. You know, it could be a problem, it could be a cool technology, and we evaluate what is the strategic fit here, how does it fit our strategy, and then prioritize what do we want to work on next. There's only limited bandwidth available. And then we build out this kind of strategic, financial, and clinical case for each app. So we're looking at an app maybe for PTSD. And so what is the business case here, as Dick mentioned one of his bullets, right? What's the financial sustainability? Is it clinically relevant and proven? Is there some research that shows the efficacy of the solution? And then how does it fit with our overall strategy? So those are some checkpoints. Then we develop the solutionization. As Dick said, the technology is the easy part. Getting it into the workflow, training people on it, measuring the efficacy, and all of that. That is the heavy lift. And so we're developing a culture now of digital health innovation adoption within CCN, looking at design thinking and making it very workflow centric and doing iteratively through an agile approach. And then doing a proof of concept to validate assumptions on a small scale, work out the kinks before we roll it out then to the broader audience, again, using change management principles. So this is kind of the roadmap of what's ahead here for the next months to take one idea here through this prioritization process and then through the implementation process to ultimately then end up with. And it requires leadership, and it requires project management as the foundation and as the overarching driver for digital health adoption. So with that, wanted to share here the journey that Kathy and Dick has worked on for a long time from a strategic perspective, and that I was invited to join a few years back. And it's fascinating. It's great to work with this organization and to see how relatively easy it is to bring new change about. And it's because Dick and his leadership team have really set the foundation for people know that staying still is not an option. We need to continuously improve, and so everybody knows that it is coming, and that makes it much easier to achieve the outcomes that we have achieved to date. I'll hand this back over to Kathy now, and we can probably stay here, but I'm not sure if we can bring the virtual assistants over. Otherwise, our wonderful technician who is juggling the technology in the background, Dan here, is going to switch us over. So Kathy will lead us through a Q&A here, and then we'll wrap it up with a few more slides. Kathy, I'll hand it over back to you.
Great. We can sort of co-facilitate this, Christian, for any questions that you see in the room, and might
Sure.
alert us to any questions that have come up in the chat, because we don't have visualization into the room very well. So welcome questions in the room or here in the virtual Zoom room.
All right, good. We have one question in the room here.
Hello, my name is Igor Gorlatov. I'm with Kepler. I very much appreciate your presentation from the point of view of tactics. So you gave very detailed outline of what exactly was done, how the execution was handled. But I'm curious, maybe I missed this because I was late from breakfast, the strategic aspect. And in my understanding, strategy is something that should be simple, that should have a clear guiding principle, that should have a clear opportunity outlined, and create like clarity for everyone involved. So could you come back maybe and highlight what was the strategic thinking in implementing this process and how it evolved as you ran into those technical implementation challenges? Thank you.
Okay, thank you for the question. And I think Kathy, maybe.
Yeah, why don't I start and then Dick can build off of it. Yes, you're right. In the earlier part of the conversation, we did share some of that. And so specifically CCN's strategic direction for 2019 through 2022 had clearly identified a desire to innovate in service delivery, really around the purpose of access and cost effectiveness. And so this strategic direction was sort of already cemented in the overall strategic direction. And then specifically from that, a variety of annual action plans had been laid out pre-pandemic. Dick, you can build off of that.
Yeah, that's a great question. We did cover that at the beginning, but that's the most important aspect, what you just point out. Again, as I said, pre-pandemic, we had already charted a course, in particular with telehealth, which I'd indicated was not widely used in the mental health field. But this was something that strategy really is what drove it. Our goals, our strategies, and actions. So we were already set up to do this. Digital health came about as we were doing telehealth in a new strategic direction that was adopted. So all of this, your point is exactly right. It has to be based on clear strategy, and it has to be justifiable based upon what the needs of the organization are. So that has driven everything that we have done. It's also created legitimacy, and this strategy is endorsed all the way up through the board of directors. This is not something that is closely held. But without that strategy, without that clarity, it's virtually impossible to try to get any movement that would persist.
Thank you.
Very good. Thank you, Dick. I see there's no questions online. Are there any other questions here in the room? Well, we have the mic here. Anybody wants to have a question? Randy, yes.
If you look at the organization pre-telehealth initiatives, and you talked about access and that sort of thing, and you look at it today and you're evolving to digital health, do you see an impact on the top line, the cost line, and the bottom line?
That is because there's a lot to unpack there. Vermont funds these services much differently than other states. For the most part, we are not on a fee-for-service basis. And over 90% of our revenue for Rutland Mental Health Services is from the state of Vermont through PMPM rates for adult and children's mental health services, and also for developmental disability services. So it sort of complicates this from a business standpoint when you look at the investment in technology and human resources in order to do this. Because by doing more doesn't necessarily get you more. And that's complicated with population health. Again, this population health, fixed payments, prospective payments, that's one of the biggest challenges you have, is to try to really have a better understanding of how you can increase efficiencies, which may come with increased costs for a period of time when your revenue is relatively fixed. At this point in time, now we just again, we just received a grant to a part of becoming a certified community behavioral health clinic, which is transformative in and of itself. But that's really one of the challenges. Many other states don't face this. Organizations, if you do more, you get more, or fee for service, and you're able to justify the expense because of your ability to either become more efficient or raise more revenue. It's more complicated here, and that's one of the things that we have to really take a very close look at, because sky's not the limit. Doing more doesn't necessarily get us more. So that's a great question.
Very good. Very good questions. Thank you, Dick, for your excellent answers as well. All right, we'll be switching over the technology back to the screen share. Kathy, I will advance on your behalf here on the last slides. I'll let you know when we're up and running here in the room. And then also I'll be available for additional questions afterwards. Also have a few handouts if you're interested here at the front of the room. Kathy, the slide is up, and I will advance at your command here. I'll advance to the next slide where we had the outline of the agenda.
Excellent. Great. So thank you. So kind of bringing all that together then, we've kind of laid out some key concepts that hopefully one or more have resonated with you about the being strategy driven. I hope this case study about Community Care Network and their transformation from telehealth to digital health has been informative. Going on to the next slide there, Christian. We hope, as this case study has highlighted, transforming an organization to become excellent is never an accident. It requires high intention, like Dick has modeled here, sincere and persistent effort, intelligent direction. In this particular case, that direction is articulated in the strategies of the organization, and all of that skillfully executed. I believe excellence is the best choice among many other alternative paths, but it requires all of these ingredients to truly set a direction and implement it successfully. And then lastly, as Christian mentioned on the next slide, we are definitely available for clarifying questions. We've included a number of resources on the resource page, a couple of different white papers and others, things that go a bit deeper into some of the concepts we've shared with you today. Hopefully you'll find some of those free resources of value. And feel free to reach out to Dick, myself, or Christian if you have clarifying questions that you'd like to talk with any of us about one-on-one.
And one specific suggestion I would like to make is tee up the video to the section of Dick's present part of the presentation and have your executive leaders watch that section of where Dick talks about the importance of strategic planning and the commitment. So I think that was really valuable, and that's why we were excited to hear that this was recorded, because you can share it back with your leaders, with your leadership teams, as one example of how one leader has strategically approached and it is achieving all these goals and on execution on a regular basis. So I always find that very inspiring to share with other leaders, because other leaders are looking for examples what others are doing. So feel free to do that. Good. With that, thank you very much. Have a good rest of your morning.